Hello everyone and welcome to another episode of Ask Dr. Bob. Some very good questions today. Question number one. Dr. Bob, I heard turmeric or turmeric is soy. It is not soy. Turmeric is a phenomenal antioxidant, and it actually can come from mustard seed. You may consider adding that to your regular routine. Dr. Bob, my nose drips when I'm in cold weather, and it really bothers me. It's a continuous drip. What I have learned along the way is this. When there are seasonal changes that compromise thyroid function, weather may be a factor. So, what does that mean? In the fall, when it's cold outside, and your thyroid's not up to par, it could mean that your body needs some iodine. I'd encourage you to have a thyroid profile done and maybe a urine iodine loading test. Dr. Bob, do peanuts cause hypothyroid? That's really an excellent question, because peanuts really come from or have an issue with yeast. And if you have a yeast problem, and I'm not saying all people who have subpar thyroid or low thyroid have a yeast problem, but if you have a chronic thyroid and you have a passion for peanuts, which I see many people do, you may consider transitioning over to almonds. Dr. Bob, what happens if your thyroid gland has been removed because of Hashimoto's? Well, I can also tell you from my experience and just listening to my different mentors, you probably need to be on some kind of drug, thyroid medication to create T4. Dr. Bob, I'm 52 years old, full menopause, really frustrated, been to a lot of different doctors, a lot of different diets, and you wanted some help. Well, here's my help to you. I would encourage you to get Dr. Bob's Drugless Guide to Balancing Female Hormones. That book may provide you the answers that you need to address what's going on. For me to sit here and tell you what to do, I'd get off of fruit, I'd get off of gluten. You probably want to take a probiotic, but not knowing really anything else about you, fruit, wheat, and sugar will destroy the best of all diets. It'll torpedo all of your good work. Now, Dr. Bob, I am so confused. Someone said that their TPO, and they actually wrote down TPA. TPO is a test for Hashimoto's, was high, was 900, which is quite high, and she's having symptoms of low thyroid. I want you to know this. Hashimoto's is an autoimmune problem. Low thyroid is low thyroid. Oftentimes people who have Hashimoto's have low thyroid. I'm going to tell you what I have learned with Hashimoto's is you want to get off of gluten. We also supplement with selenium and vitamin E, but we have a program that we follow to help improve thyroid function. Dr. Bob, how do I get tested for parasites? Well, obviously the very first way, and it's not 100% accurate, but it's a way, it'd be the stool culture, a stool test to your fecal material. You may consider a CBC with a differential. Look at your eosinophil count, and wherever you live you might look for someone who has dark field or phase contrast microscopy, because they would actually be able to see the parasites in your body. And this is a huge problem going on in our society right now. Can you help with conversation with histamine? Now this person went on with a lot of other challenges going on, but I want to address the histamine. Histamine to me is usually a liver challenge. All the other all the other challenges that you have, I would say are probably digestive related. When people come in and have a bizarre, lots of challenges, aches and pains here, there, and whatever, I always look to the colon. Possible you could have a fungus or a yeast problem or a parasite problem. Avoid sushi, wild game, and be aware if you have cats, because you could have a digestive challenge because of the parasites from them. What do you suggest for macular degeneration? Cruciferous vegetables, broccoli, cabbage, and cauliflower. Dr. Bob, my daughter has dark circles underneath her eyes. She's, for about 8 years, tried many remedies. Dairy and gluten. Get off of dairy, and gluten. Last question. Dr. Bob, should I take the stress bundle to handle my first depression episode of my life? I would encourage you to have an essential fatty acid blood spot test done. I'd also encourage you to look at Dr. Bob's Guide to Stop ADHD in 18 Days, because we talk about oil. Depression is usually lack of oil and subpar thyroid function? Wonderful questions. Thank you once again. I'm Dr. Bob DeMaria.